The Moral Right to Healthcare by Jessica Sprague. Healthcare is not a right, but rather a moral responsibility for an industrialized country. Marr, 2008. When we ask ourselves about the moral right to healthcare, we must evaluate the elements that contribute to our principal goal as healthcare providers. These elements are cultural competency, code of ethics, and resource allocations. Cultural competency includes the understanding of what culture is: language, communication, courtesies, rituals, roles, customs, relationships, practices, expected behaviors, values, thoughts, and manners of interacting. Cultural competency includes all of these factors in awareness of diversity, identification of cultural disparities, creation of programs designed to address disparities, and individual behaviors associated with cultural sensitivity and proficiency. Bastios defines cultural competency as the ability of a healthcare provider to function effectively in the context of various cultural beliefs, behaviors, and needs presented by communities and consumers. He went on to elaborate in saying, culture is of the utmost importance in a clinical encounter. It is often essential to appropriate diagnosis and treatment, and it is always central to caring for the patient because it is a major determinant of an individual's health beliefs, values, perception, and behavior. Healthcare services that are provided to patients of varying cultural backgrounds cannot be provided on a broad spectrum to best serve the needs of the patients due to varying cultural needs such as religion, food, family, and personal values. Many cultures also experience different reactions to treatments and medications. Therefore, in order for treatment and services to be effective, they must be treated with consideration to cultural and environmental differences. Healthcare management also needs to address diversity in order to better serve patients' needs. This can be accomplished by assessing the needs of the service population, hiring individuals with diverse backgrounds, providing diversity training, continued education programs that provide secondary language skills, providing flexibility, and practice unbiased recruitment. Some current organizations setting the tone for this are the Mayo Clinic and Cancer Treatment Centers of America, who pull together teams of doctors to address individual healthcare needs and develop a plan of treatment that includes conventional and supportive therapies such as diet, exercise, spiritual, and alternative medicines. We can use these examples to diversify and improve how we address our patient population to surpass the current standard of cultural competency. We have a moral obligation to provide not only health care, but culturally competent health care, which is rooted in our code of ethics. Our principles, self-determination, fiduciary duty, benefits, non-malfeasance, and justice, guide the decisions that we make and the development of expectations of the organization and its members. Characteristics that should be maintained are communication, accountability, continuous learning, respect, and teamwork. Our code of ethics, principles, and moral values require that we provide health care fairly, equally, to the best of our ability, for the benefit of others, and to make sure that our patients are treated with respect. We accomplish this through the 5 functions of management planning: organizing, staffing, leading, and controlling human and other resources to achieve organizational goals. Our code of ethics is the structure that defines these functions and the roles we play as healthcare providers. This is not to say, however, that people have the moral right to challenge healthcare. I agree with the opinions of others who believe that healthcare is not a right like having the right to bear arms, or freedom of speech, or the right to vote, but rather a moral responsibility for an industrialized society. If we establish healthcare as a legal right, then we unfairly impose healthcare as an obligation, rather than a moral and ethical responsibility of medical professionals. This undermines the ethical principles established in the medical profession. As a healthcare organization, we are responsible for the medical care provided in our communities regardless of legal obligations and based solely on our moral obligations and our oath. Which brings us to the next topic, resource allocations. In order to maintain the first objective, cultural competency, fulfill the second, confirming our code of ethics, and maintain our moral obligations to the community by providing the health care that's needed on an individual basis, we must establish ethical resource allocations. Using several key components, such as equitable distribution, community need, contribution, merit, and effort, we can establish distributive justice allocating resources while maintaining cultural competency. To ensure the company code of ethics is maintained, the use of procedural justice to determine which procedures and policies are needed will be implemented. Although these decisions are often difficult for us, we have a moral obligation to the community to provide as much care as possible, as effectively as possible, and without letting patients and organization members fall through the cracks. We have 4 approaches to determining resource allocations that can be utilized: expert panels, community consensus, lottery, and court order. In summary, as healthcare providers, these decisions cannot be taken lightly and must be determined using ethical, moral, and justified reasoning in order to ensure the healthcare organization is providing what is promised: care. Through cultural competency, a code of ethics, and ethical resource allocation, we can do more than provide a patient the right to health care. We can fulfill our moral obligation as a community and as an industrialized society to help our fellow man. Thank you.